Hi, my name is Winnie O'Connell, and I'm going to talk a little bit about my health insurance plan and a little bit about a procedure to see how much that procedure might cost and what health insurance might cover. I have an HMO plan from Health Insurance Marketplace. My copay for visits is $20 a visit, and my deductible is $500. I chose to research deviated septum repair. A deviated septum is what happens when the bridge between the nostrils of your nose is further over on one side or the other, and it kind of blocks off the other the nostril from getting any air or enough air through the passage. It can cause noisy breathing, nosebleeds, headaches. It can cause snoring, and it can even cause sleep apnea. I chose to research this because I think my daughter might actually have a deviated septum. She's very kind of a noisy sleeper. She tosses and turns a lot, and she even sleeps with her eyes open, which is a little bizarre. The surgery for a deviated septum is called septoplasty, but when I was researching septoplasty on the websites, it didn't seem to recognize that that's what the procedure is called. And so for the first website, I believe I looked up nasal passage repair, and on the other website, I looked up nasal septum repair. These procedures I had a hard time finding on the websites in the book, except for Fair Health Consumer, which it seemed to come up with results pretty quickly. For clearhealthcosts.com, I could not find a result in my area at all, even though I know that this procedure is often done in my area. It just didn't have results for that, and I had to kind of type in words to find a procedure that I was looking for. I couldn't just type in septoplasty. I couldn't type in deviated septum repair. I had to type something in and choose out of a list of items something that would match what I was looking for. According to fairhealthconsumer.org, in order to have a septoplasty done, the procedure would cost you, if you were uninsured or if you were using a provider who is out of your network, about $3,882. An in-network price for somebody who was insured would be charged around $1,727. According to clearhealthcosts.com, the one that I could find that was probably the only one that existed, actually, was somebody who had the procedure done in Utah, and he paid out of pocket, he paid $1,503.12, and his insurance wound up only covering $386.88, and he actually made a comment on the submission that he was surprised because he was told that his insurance should cover most of the procedure, and he wound up paying quite a bit of money for it. I was kind of surprised because overall I thought the procedure was lower in cost than I would have originally imagined, but the procedure, it is $3,000, $4,000 is nothing to sneeze at, and according to where you might live, the procedure is going to cost more or less depending on, what the going rate is in your area. As a healthcare consumer, I think I would utilize these tools to kind of shop around and find the best price for a procedure in my area. I also think that it is important to get an idea of what this is going to cost before you go into it. Contacting your health insurance, contacting your doctors and things, and trying to find out what things are going to cost is very important. It's important to know beforehand so that you're not as surprised afterward. However, there always seem to be those costs that they slip in there on the bill that you weren't aware were going to be included. And that's kind of a tricky thing to deal with. However, I do think it's important to completely understand the bill that you're receiving and what you're paying and what your health insurance is going to cover.